Hi, in this lecture, we're going to be talking about historical and modern models of psychopathology or abnormal psychology. Okay, so in the last class, we talked about the 4 or 5 Ds of abnormal psychology. And of course, behaviors, thoughts, and feelings that are considered deviant, that are dangerous, that are dysfunctional and distressing, and that are persistent patterns have been recognized throughout human history. And just as a reminder, this is kind of the definition of psychopathology that we are going to be using throughout this class. It's important to remember that it's not just behavior that we're talking about, but also thoughts and feelings. This lecture is going to kind of give you a very vast and broad overview of historical trends in understanding of what causes and kind of implicitly how to treat psychopathology. In at least European and American history, there have been kind of 3 categories of explanatory models of psychopathology throughout history. We're going to talk about all 3 of them. And then at the end of the lecture, we're going to talk about how our modern understanding of psychopathology takes into account all of these models. Okay, so probably the oldest models of our understanding of psychopathology are spiritual. And the idea is that the behaviors and also the thoughts and feelings that are characterized by the 4 Ds and that are persistent, so duration also, is caused by evil spirits, demons, or the devil, something external to the person, some outside force. Exorcisms were a dominant treatment, so rather than having physicians or any kind of mental health practitioner treat psychopathology, under a spiritual model of psychopathology, religious figures would be the ones often to treat psychopathology with religious rituals like exorcisms. Religious traditions that didn't believe in exorcism, so like American Puritans, also sometimes saw these patterns of thought, behavior, and feeling as characterological. So it wasn't so much that it was caused by an external force to the person, or if it was caused by an external force, there was really nothing that could be done to ameliorate it or get rid of it. There was just something inherent about that person that was unchangeable and untreatable. So religious traditions that had a spiritual view of mental illness and that saw mental illness as characterological, rather than necessarily treating it, would often practice things like shunning or even execution. So this is kind of one take on, for example, the Salem witch trials. Okay. In addition to exorcism, there was a more physical treatment, a more sort of medical, biological treatment for spiritual causes of mental illness. This has been practiced for a really long time all over the world, not just in European history, but in Central and South America, North American indigenous populations in Asia, all over the world. This practice is known as trephination, and basically it involves boring a large or small hole in a person's skull. The idea was that this would release this outside external force that was causing the abnormal thoughts, feelings, and behaviors. What this skull is actually showing is that even though this treatment might seem kind of primitive and really dangerous, especially before we had like germ theory and an understanding of how to practice surgery in a hygienic way, people did survive this procedure. So this is showing bone regrowth. So this person, after having trephination practiced on them, lived for many years. So even though trephination is practiced in cultures that have a spiritual understanding of mental illness, it shows that even when the understanding of mental illness is spiritual, there was always kind of this understanding that the brain is really intimately involved in thought, feeling, and behavior, and that there might be kind of physical ways to treat mental illness. So some people still today have a relatively spiritual understanding of psychopathology. In charismatic churches like the Pentecostal church, or in certain evangelical churches, there's a belief in charismatic gifts, including the gift of prophecy, the gift of miracles, the gift of tongues, and the gift of healing. So in these religious traditions, people practice faith healing, where they call on a spiritual power to remove a physical or mental disease. But even people who don't believe necessarily in faith healing still may have a relatively spiritual understanding of the causes and treatment of mental illness. So this is an example of a modern spiritual understanding.
Something could be wrong. He was not able to tell me what was going on. Instead of being able to communicate with me and tell me he was having a hard time or that he didn't feel well, he would just cry, and then he would bite himself until he would bleed. The doctor referred them to a specialist who gave them the news they dreaded.
He said, "I'm sorry to tell you that looks like your son might have autism."
And having the doctor tell me that he had autism was like a kick in the stomach.
It's like the doctor handed us a sign, and here's your sign. This is what you guys are going to have to deal with for the next rest of your life.
One doctor told the Waldens Ethan would probably never speak. So with little help or direction, they began to care for their son. But raising Ethan was exhausting and stressful, and that strained their marriage.
So there's a lot more arguments, a lot more disagreements. I have my thoughts about what we should do. She has her thoughts about what we should do.
Then one night they realized they were up against something more. Gina says she had a vision of a dark presence in her son's room. She woke up in a panic. I remember getting up, I ran down my hallway, and I ran into Ethan's room, and I just fell on the floor, and I just cried. I cried my eyes out.
I pick her up off the floor and we start talking, and something went off in my mind at that moment, in her mind, that said, this fight is as much a spiritual battle as it is a physical battle.
They realized only their faith in God could help them face the challenges of raising their son.
So the next morning I got up and printed out a bunch of Bible verses. I started getting up earlier and praying and seeking God, and then Gina started doing the same thing.
Soon after that, they found an autism specialist, Janelle Espling.
Looking at Ethan then, he looked like he would be a student that would progress very slowly.
Janelle was also a Christian, and like the Waldens, believed prayer was just as important as therapy. She prayed with the Waldens daily.
We could see that everything we were doing was working and that he wasn't becoming stagnant, and it didn't look like he was going to become stagnant anytime soon.
Okay. So setting aside whether you have a spiritual, biological, psychological, or integrated model of mental illness, including autism, this is obviously a very stigmatizing way to talk about autism. It frames raising a child with autism as a burden. It frames the autism diagnosis as this devastating news. But setting that aside, this is an example of kind of a modern spiritual perspective on mental illness. It's not unidimensional. This family obviously realizes that there's a biological aspect to autism, and they sought out evidence-based treatment, but they also incorporated their faith. And whether you see that as something that actually directly intervened on the symptoms, or whether you see it as something that maybe helped keep up the family's morale, helped keep them motivated and working with professionals who shared their religious beliefs, but also who are delivering evidence-based treatment that helped the autism. This is an example of a modern spiritual model of mental illness.
Ethan was...
Okay, so the next historical tradition we're going to talk about is the biological model of mental illness, which broadly is any model that attributes the 4Ds, and again, the 5th D is duration, but dysfunction, danger, deviance, and distress, to physical causes in the body or in the brain. So an example of an early biological theory is the humoral theory of both physical and mental illness. So the humoral theory is often attributed to Hippocrates and Galen, and it was also promoted and refined by the physician Avicenna. But this tradition moved both psychology and medicine away from a spiritual understanding and towards a more physical approach. And these practitioners didn't differentiate between mental and physical disease. They saw it all as having the same causes. And the cause that they believed all disease had was imbalances in the body's 4 humors. So this was a theory that there are 4 fluids that run through our veins in our bodies, and that maintain our healthy functioning, but that when they're unbalanced, they cause specific physical and mental symptoms. And generally, the humor of blood was attributed to symptoms like mania. It had to do with being like passionate and fiery and outgoing, but when it was unbalanced, it could cause mania. Black bile was thought to cause aggressive thoughts, feelings, and behaviors, whereas yellow bile was thought to cause depression and sadness. And phlegm, mucus, was thought to cause apathy when it was unbalanced, when there was either too much or too little in a person's body. So generally, under the humoral theory of medicine and psychology, the 40s and physical illnesses were treated by either removing excess humors through things like bloodletting or inducing vomiting, or using medicinal treatments to try to alter the humors and restore balance. Another example of a biological theory of mental illness, so again, thinking that there's a specific physical biological cause in the body that causes these symptoms, is the idea of hysteria, which dates back all the way to Hippocrates. This was believed to be a condition that affects women, characterized mostly by psychological symptoms, including mood swings, depressed mood, so melancholy, and agitation. And Hippocrates and other physicians attributed hysteria to improper movement of the uterus through the body, wandering uterus. And Hippocrates and other physicians believed that it was caused by a lack of sex, like not having enough sex, not having the right kind of sex. So for a very long time, throughout the Middle Ages, starting with ancient Greek physicians and continuing into as late as the 19th century, there was a belief that a lot of mental health symptoms in women could be attributed to the uterus and to kind of female reproductive biology, and that maybe sex and orgasm were a treatment for those symptoms. A biological treatment that has been used even more recently in human history, in our recent history, is lobotomy. So lobotomy is a procedure that involves severing the corpus callosum, which is the band of nerve tracts that connect the two hemispheres of the brain, so the two halves of the brain. I'll talk about this a little bit more in the neuroanatomy lecture. But the goal of the lobotomy, the sort of biological theory of mental illness, was that something about the brain of people with mental illness, and different lobotomists had different theories, but actually there wasn't a lot of theoretical basis to this. But something about severing the two hemispheres of the brain, interrupting communication, could treat mental illness by just sort of overall calming a person's emotions. So the biological target, like I said, was the corpus callosum, which is the connection between the two halves of the brain in the frontal lobe, so in the front part of our brain, the part right behind our forehead. This part of the brain is involved in a lot of really important human thoughts and behaviors. We need it for planning ahead. We need it for complex thought. We need it for self-control. And the corpus callosum facilitates communication between the two halves of the brain. So part of the theory behind the lobotomy is of the idea that severing communication between the two halves of the brain might help to calm people's emotions and behavior. That's not true, but what is true is that severing the corpus callosum can be a treatment of last resort for treatment-resistant epilepsy, because when a seizure starts in one hemisphere of the brain, it spreads to the other hemisphere of the brain via the corpus callosum. So for people who have epilepsy that doesn't respond to medication, sometimes what's known as, sometimes not a lobotomy, but a surgical severing of the corpus callosum can be a treatment.
Using them on people who, by anyone's standards, were perfectly normal. Hi there, Howard, I would guess.
Hi, I'm Howard Dolly.
Hello, I'm Michael Mosley.
Glad to meet you.
And you. So this is your sort of childhood neighborhood, is it?
Yes, it is. This is the place.
Which way's the house?
House is over in here.
What were you like as a child?
Well, I wasn't an angel. I was very rambunctious. I liked to roam the streets a lot and liked to be alone. I found out if I was alone, I didn't get in trouble.
Yeah.
Because no one was there to get me in trouble. And I just wanted to be left alone, pretty much.
Howard's mother died when he was just 5 years old. His father married again, but Howard and his new stepmother, Lou, had a very difficult relationship.
I that she was trying to take the place of my mother, and I resented that. So
How did she respond?
she would punish me or do things to me that would aggravate me, so it would just snowball. When she did something to me, I'd do something back, and pretty soon it just got out of hand.
Their relationship got worse and worse, to the extent that Lou took Howard to see Dr. Freeman. It was just before his 12th birthday. Do you think she had any appreciation of what a lobotomy would do?
I don't know that she cared. I think that she just wanted a solution to me, and whatever that solution brought, she was willing to accept.
This picture shows Howard undergoing his lobotomy.
I wasn't changed that much. I would still have my faculties and things. I thought she was going to get more of a docile, robotic type kid that she could control.
If the lobotomy was supposed to pacify Howard, it failed. He became increasingly disruptive. Unable to manage him, his parents sent him away from home forever.
I had gone to several people's homes and then made a ward of the court at juvenile hall. And since I didn't commit a crime, they sent me to Agnews at age 13, 14 years old. And I was put in with adult mentally ill patients.
Right.
I just was a kid that had no place to go, is what they kept telling me.
Right.
We have no place to send you. And then I went back to juvenile hall, back on the streets, got in trouble because I didn't have any skills or know how to live. And went back to Agnews till I was 20. It was either that or prison.
Do you think Walter Freeman stole something from you?
I think he took my childhood. I think he took my childhood and some of my adulthood, because I'm probably about 20 years or better behind the average person.
Okay, so what Howard Dolly's experience with lobotomy illustrates is partly a relatively extreme example of the dangers of practicing any kind of healthcare, including mental health care, without a clear etiological understanding of what causes the disorder and what problem you're intervening on to try to fix. Etiology just refers to an understanding of the origin of something, in this case, the origin of an illness like psychopathology. So lobotomies were supposed to just kind of pacify people. It was supposed to make people less emotional, less volatile, have less intense, strong emotions. It was used as a treatment for depression, but also for more severe mental illnesses like schizophrenia, bipolar disorder, disorders that often caused people to be institutionalized during this time period. So some practitioners probably did believe that it was actually treating the physical biological cause of an illness, but in many cases it was also practiced in order to just pacify people and make them more docile and easy to deal with in an institutional setting. Okay, so obviously we still today do have a biological understanding of mental illness. The brain is part of our biology. The brain is the origin of thoughts, feelings, and behaviors. And there are physical treatments that intervene on targets in the brain and in the nervous system to try to treat the symptoms of psychopathology. So examples of treatments still being used today include electroconvulsive therapy, also known as electroshock therapy. This is used to treat severe depression, and bipolar disorder also has been used for schizophrenia. But primarily today it's used to treat depression. On maybe more of the cutting edge, and this is mostly now being used for neurodegenerative diseases, so pathology in the brain that has a known cause, that has a known degenerative disease process in the brain, like Parkinson's disease. But for diseases where we know that parts of the brain are damaged or dying off, psychosurgery is a treatment that can implant electrodes in the brain that can help to stimulate those brain regions in ways that the neurons that are dying off in those brain regions because of a degenerative disease process no longer can. So psychosurgery or implanted brain stimulators is a cutting edge treatment, currently mostly being used for Parkinson's disease and other forms of cognitive impairment, but that in the future might be used to treat what we would recognize as psychopathology, things like depression, OCD, schizophrenia. But of course, the most common biological treatments that we use today are psychotropic drugs. So these are psych medications that act on systems in the brain and nervous system, including antidepressants, anti-anxiety medications like anxiolytic drugs, antipsychotics, stimulant drugs like Ritalin for ADHD, and then psychedelic drugs, so drugs that have a psychoactive effect like LSD or like THC in marijuana, and opioids, which have analgesic effects. So as we'll talk about in subsequent lectures, these drugs act on neurotransmitter systems in the brain. Neurotransmitters are the way that cells in the brain and different brain regions communicate with each other and cause our behaviors, thoughts, and feelings. So the biological treatments that we use are all aimed at influencing the functioning of neurotransmitter systems, replacing lost function of neurotransmitter systems, or modifying the functioning of neurotransmitter systems. Okay. So as I said, electroconvulsive therapy is still used today, but it probably doesn't look like what you picture when you think of electroshock therapy. So this is just a demonstration of what modern electroconvulsive therapy, which again is primarily a treatment for depression, looks like.
Electroconvulsive therapy, or ECT, is often called a treatment of last resort for patients who haven't had success with drug therapies, who have life-threatening psychiatric conditions, or who are suffering a catatonic state. ECT induces a brief seizure in a patient which resets the brain functions associated with some psychiatric disorders.
It's typically indicated for treatment-resistant psychiatric conditions, most commonly mood disorders or depression, but there are multiple types of depression, so it can also be used to treat bipolar depression.
The majority of ECT treatments are managed like outpatient procedures, and the patient is given general anesthesia.
When the patient's asleep, the stimulus is delivered, the seizure is monitored, they'll have just one seizure.
An electrical current is given to the brain, low enough not to harm the patient, but high enough to trigger a seizure. The treatment team can even touch the patient.
The thing that concerns patients the most is that they know that they will be having a seizure. They're concerned about what may be happening while they're either asleep or while they're having that seizure. And thanks to the anesthetic, it's very hard to tell. In fact, only way you can truly tell if they're having a seizure or not is to kind of monitor the motor activity and then monitor the EEG activity.
The patient awakens soon after and is monitored for a short while like any patient who has undergone general anesthesia. Within a half hour, they'll be discharged. In some cases, a handful of ECT treatments may be all that's needed to make medication therapy work. For other patients, regular recurring ECT treatments may be needed. In Morgantown for the WVU Health Report, I'm Dr. Raleigh Sullivan.
Right. And then electroconvulsive therapy, as he said, is used when medication treatment doesn't work, but after a person has had ECT, it potentiates the benefits of both medication therapy and psychotherapy for depression. So it basically helps people be more responsive to other treatments for depression. Okay, so that was our brief overview of kind of the history of biological models of mental illness. The last category of model that we're going to talk about today is the psychological model. So whereas early medical practitioners like Hippocrates, Galen, and Avicenna didn't really make much of a distinction between disorders of behavior, thought, and emotion, and disorders of other parts of the physical body, the psychological models of mental illness make a distinction between the physical body and mental processes. And that's kind of the key to these models, that the idea that there's something separate about the mind that isn't touched by our physical being, that isn't influenced by our physical body, and that doesn't depend on the state of our physical body. So the idea here is that psychopathology is caused by emotional and mental processes within the mind. So a brief history of how psychological models developed. By the 19th century, so the 1800s in Europe, the biological model of mental illness was very dominant. It had pretty much replaced the spiritual model for like educated people and people who had access to any kind of treatment. During the 1400s through the 1800s, there was this sort of transition from Humanism, so the idea that all physical health is influenced by the balance of 4 fluids in our bodies, to a more modern understanding of the body and medicine that was based on anatomy. So during this time period, medical education involved a lot of observation, a lot of dissecting animals and humans to try to understand the physical structures of the body. So during that part of European history, our understanding of the physical body became more and more anatomically detailed and correct. But the problem with this is that this very anatomical, biological understanding of the body that was mostly based on cadavers and dissection didn't really help us understand behavior, thought, and emotion. Just looking at a brain, especially like a physical brain, when it's not functioning, when the person is dead, really doesn't tell us anything at all about thoughts, emotions, and behaviors. And this observation is kind of what gave rise to the psychological models, this idea that the brain is just this hunk of matter. Dissecting it doesn't give you much insight into how it works. So maybe there's something more to thought, emotion, and behavior that can't be explained by anatomy. In addition to this understanding, there was also basically an increasing awareness that medical treatments for problems relating to behavior, thought, and feelings didn't really work. We didn't, or at the time, European physicians didn't have good treatments for these problems. So one of the dominant treatments for serious problems of thought, emotion, and behavior was institutionalization. And the conditions in mental institutions were really poor, really terrible. The treatments didn't work. And so there was this perception that mental illness was basically untreatable, that when someone had serious problems with thought, emotion, and behavior, there's really nothing that could be done for them. They just needed to be removed from society and kept somewhere. So it was in this context, this idea that A, looking at the brain and the body doesn't tell us anything about thought, emotion, and behavior with the tools that we had at the time, and B, the treatments that we have at the time don't really help with problems related to thought, emotion, and behavior. So institutionalization and just locking people up was the dominant treatment. In this context, 2 new ideas arose during the 1800s. So the moral therapy movement and the mental hygiene movement. The moral therapy movement was basically a social justice reform movement for more humane treatment of mental patients and people who are institutionalized. In addition to arguing that just because someone's thoughts, emotions, and behavior are deviant, distressing, dangerous, or dysfunctional, doesn't mean that they don't have human rights and doesn't mean that they don't have whatever the idea of civil rights was at that time, so the same rights as everybody else. There was also the observation that people's functioning improved when their physical conditions improved. So institutionalized patients did better when they had a cleaner environment, when they had better food, when they had more opportunities for rest and socialization. So there was this growing understanding that maybe a way of treating and rehabilitating people with severe mental illness was to try to intervene on their physical environment, to try to improve their physical health, to try to make them feel physically better, to give them a clean, safe, dignified place to live, and to integrate them back into society. At the same time, the mental hygiene movement was a sort of increasingly dominant view of psychopathology, of the causes of mental illness. And similar to this idea that mental patients are human beings and deserve fair, dignified treatment, there's also this understanding that because mental patients are human beings just like everybody else, we might actually be able to gain some insight into the problems with thoughts, behavior, and emotions by trying to understand quote unquote normal thoughts, behavior, and emotions. So we might be able to learn something about psychopathology by studying the psychology of people who aren't ill. And this is kind of where the scientific study of psychology originated. So around the same time, as there was this increasing recognition of mental patients as humans with human rights who deserve dignity, and this understanding that we might be able to learn something about mental processes and mental illness by studying typical development. Sigmund Freud, who actually had a biological background, he was a medical doctor, a neurologist who studied the structure and the function of the brain, became increasingly interested in the structure and function of the mind. So of this idea that there's a separate psychological process that happens independent of the physical brain. And Freud's model of psychology emphasized unconscious processes, so things that are happening in the mind outside of our conscious awareness. And what Freud's theory, the psychodynamic theory, is most known for is the three-part structure of the mind and the psychosexual theory of development. So those two specific things don't really have any evidence base. We don't consider them valid theories anymore in modern psychology. But one observation that Freud helped to popularize, and that he was a very strong proponent of, that we do still see as evidence-based and an important part of modern psychology, is that childhood experiences have an important impact on adult functioning, that parenting is important, that the relationships that children have with their caregivers as they're growing up can influence their functioning as adults and can, in some cases, influence problems with emotions, thoughts, and behaviors throughout life. Okay, so the three-part structure of the mind under Freud's theory, which again, there's no modern scientific evidence for this, but this was Freud's framework of understanding where problems with thoughts, emotions, and behaviors arose. So Freud believed that every human had three structures in their brain: the id, which is this kind of animalistic structure that seeks pleasure and gratification. Its only motivation is survival, pleasure, and gratification. It's not rational. It's not really fully human. It's present at birth. It's the only structure in the infant mind. And then over time, the other structures develop through socialization and through exposure to society. So the first, or rather the second structure to develop is the ego, which is rational and logical, which can sort of think things through and plan ahead, but which doesn't really have a moral compass. So the id is basically like, I want it now, I want gratification, I want sex, I want food, I want comfort. The ego also wants those things, but it understands that you might have to use a little planning and a little manipulation maybe, or like a little structure to get those things. The last part of the brain that Freud thought developed was the superego, which is the part of our brain that can engage in moral reasoning. So whereas the id is all about what we want right now, and the ego is about how to get what we want and how to gratify ourselves in a rational, effective way, the superego is the part of our brain that thinks about whether what we want is actually appropriate or right, and that can also kind of delay gratification or prevent us from going after the thing that we want if our superego believes that it's not morally right. And Freud believed that these mental structures developed during the first 5 years of life and that they were very strongly influenced by parenting. So the other thing that Freud and that psychodynamic thinking is really famous for is the psychosexual theory of development. So Freud and a lot of early psychologists believed in what's known as a stage theory of development, where Freud and other psychologists of his time believed that every person passed through distinct, maybe biologically predetermined stages in development. Everyone went through them in the same order. Everyone had to go through each one in order to get to the next one. Stage theories, some of them do have an evidentiary base. This particular one does not. But as I go through Freud's theory, I'm going to try to illustrate like what aspects of his developmental theory are still consistent with modern thinking. Okay, so each of these stages, Freud believed, was characterized by the infant or the child having a different focus or a different drive towards fulfillment, gratification, and Freud thought sexual fulfillment. So Freud believed that from birth to about 1 year, people get all of their sexual fulfillment and all of their life energy is focused on the mouth. So the main problem that infants have to solve is how to get sustenance through their mouth, which they have to learn to do like as soon as they're born. So Freud believed that during this stage, the important part of development was learning how to nurse, learning how to put things in your mouth, learning how to eat orally. And this is actually true. Like this is the developmental stage where infants progress from only drinking breast milk to starting to eat solids and table foods. It is an important part of development, and it does have implications for certain eating disorders that we'll talk about later in the semester. The next stage that Freud thought children passed through was the anal stage during basically the toddler years, so 1 to about 3. This is the age where kids are becoming continent, when they're toilet training, when they're learning to control their bodily functions. The next stage that Freud perceived was the phallic stage from about ages 3 to 5. And Freud observed that this is the age when children start to express a gender identity, when they start to recognize that they have a gender that they can kind of match to the adults in their environment. So Freud believed that during this stage, children's relationship with their same-sex parent became really important. Children started to realize that they were going to grow up to be someone like their same-sex parent. So that relationship becomes very important and also potentially very like fraught and problematic. It can be the source of difficulties during this time. What we know about this stage in modern developmental psychology is that it's true that this is the age when kids do start to develop and express a consistent gender identity, but there's nothing different or special, particularly about the relationship with the same gender parent during this time. Both parents are important. This is the stage that Freud believed kids went through the Oedipus complex, where boys were jealous of their father's sexual relationship with their mother and envied their penis. And girls went through the Electra complex, where they were jealous of their mother's sexual relationship with their father. That doesn't have any evidence base in modern psychology. The next stage Freud theorized was the latency stage, which basically lasted through elementary school age childhood. And during this stage, Freud didn't think that kids went through very many important sexual developmental milestones. He thought that this was sort of the age when kids, when their psychosexual development was kind of stagnant and they were learning other things, like they were in school, they were learning complex language, they were learning behavior and manners, they were learning skills. And it is true that during this stage of development, children don't go through a lot of physical changes. So Freud, again, was correct about that, and it was based on observation of real children. The last stage Freud saw in development was what he called the genital stage. So whereas during the phallic stage, Freud believed that kids had a lot of conflict about their genitals and about their gender role development. And Freud also believed that during this stage, during the phallic stage, both boys and girls were really interested in penises, and that girls went through something called penis envy, where they realized that they weren't men, were bummed out by that, and wanted to have penises to correct that problem. Freud believed that if you progress through that stage appropriately, you would reach the genital stage, where people of both genders would embrace their biological sex and the genitals that they had, and embrace gender roles as well. So Freud basically believed that healthy development meant conforming to what society expected for your gender. And while we don't believe that anymore, Freud was probably correct that people in middle-class Victorian England were happier when they embraced their gender roles, because gender roles were very enforced and very hard to deviate from. So Freud believed that when people successfully passed through all of the stages of development, they reached the genital stage where they were able to form healthy adult sexual relationships and have families of their own. Freud believed that psychopathology originated in interruptions in development through these stages. So for example, Freud believed that if something went wrong with your development during the oral stage, so during that first year of life, if your parents were either maybe too involved or not involved enough, if you went through some trauma during that developmental stage, you'd become fixated in it. So you basically get stuck in this phase of development. Your libido and life energy continue to be focused on the mouth and on oral gratification. And that causes you to not mature through the other stages. It influences your personality and also the type of psychopathology that you're at risk for. So, for example, Freud thought that someone who was fixated in the oral stage as an adult might have a lot of oral behaviors that were problematic. Like they might have a substance use problem, they might smoke a lot, they might overeat, they might drink too much alcohol, they might bite their nails. They would do something that focused on the mouth that would cause problems. Freud didn't necessarily see a specific connection between stage fixation and any specific symptoms. any fixation basically could lead to the development of sort of generic mental illnesses like neurosis, which sort of meant anxiety and agitation, melancholy, which sort of meant depression, or hysteria, which, as described earlier, kind of meant mood swings, negative emotions, and agitation. So psychodynamic treatment, psychoanalysis, focused on identifying what stage people were fixated in, identifying their sort of defense mechanisms, so inappropriate maladaptive ways that they try to manage their fixation or manage their negative emotions, and then help them mature through the stages as they processed unconscious desires. So for example, if you were fixated in the oral stage, psychoanalysis might try to help you identify what happened to you before you were 1 year old that led to that fixation, and how that fixation has influenced the way that you cope throughout your life. So traditional Freudian psychoanalysis is still practiced. It's not evidence-based. There's no scientific evidence that it's an effective treatment for improving people's symptoms of psychopathology. But psychodynamic psychotherapy is a modern adaptation of some of Freud's theories that, unlike psychoanalysis, is short-term. It's focused on resolving symptoms and improving people's functioning and quality of life. And it has more kind of specific tools and interventions that involve helping people to learn to express their emotions, not avoid them, and not express them in inappropriate ways, try to improve their interpersonal relationships and identify recurring patterns in their interpersonal functioning that's getting in the way, sometimes using the therapeutic relationship. So this is called transference and countertransference, where a therapist and the patient will kind of use their relationship with each other as a model of the patient's relationships with other important people in their life, and kind of practice and work through issues with interpersonal functioning in the context of the therapeutic relationship. Psychodynamic psychotherapy might also consider some unconscious processes and sort of interpret them. So things like dreams, fantasies, wishes, things that aren't fully conscious and aren't fully rational. By about the 1940s and continuing through the 50s, 60s, and 70s, a dominant psychological model of the origins and treatment of mental illness was humanism. So this theory differed from Freud's theory in that humanist psychologists believed that humans are inherently good, and that if humans are allowed to develop in an ideal environment, they will just sort of naturally thrive and naturally be good. So any problem with someone's moral behavior or any problem with someone's mental health, with their psychology, could probably be attributed to a problem with their environment, either their upbringing or their current environment. This differed from Freud's idea, where he believed that humans were kind of inherently not necessarily bad, but amoral, animalistic, self-centered, focused on their own gratification, and that they needed to develop the superego and the ego and move through all the stages of sexual development in order to be kind of good, functioning people. Humanism believed that people are inherently good and that in the right environment, everyone will thrive and eventually achieve self-actualization. So be able to become the best that they personally can be. So this figure shows Abraham Maslow's hierarchy of needs, and it really illustrates that the humanists recognized that people need certain conditions to be met in order for them to be considered healthy, whether psychologically or physically. People need physiological needs. They need basically their physical needs to be met: food, water, air, shelter. Once those needs are met, people's safety needs must be met. They need to have a sense of personal security. They need to know that they have a steady job, a steady source of income, a steady source supplying their physiological needs. Once safety needs are met, people need love and belonging. So they need friendships, they need intimacy, they need family, they need time to spend on those important things. So, for example, Maslow would say that poverty creates mental illness and psychopathology because it prevents people from meeting either their safety needs or their love and belonging needs, or potentially their esteem needs. So humanism really recognized that people need material things. People need material safety, comfort, and security in order to be fully psychologically healthy. So the humanistic treatment of mental illness, of psychopathology, is known as person-centered therapy. Person-centered therapy involves minimal intervention from the therapist. It's basically kind of a safe space for people to just sort of talk, express themselves, talk about their needs, talk about how to address them. And in return, the therapist is supposed to show unconditional positive regard. So the therapist is supposed to basically exude love and caring and demonstrate to the patient that they believe that they are a person who deserves to have their physical needs met, to have their safety needs met, their social needs met, their esteem needs met, and that ultimately they deserve self-actualization. Person-centered therapy also isn't an evidence-based treatment for psychopathology. It's not symptom-focused. It hasn't been shown to effectively reduce symptoms and distress and improve functioning. So clinical psychologists don't typically practice this type of therapy, but it is still used in counseling psychology, which is a branch of psychology that focuses on people who don't necessarily have mental illnesses, but who still have goals that they want to achieve or normal life stressors that they want to overcome. Counseling psychology is the branch of psychology that more focuses on helping people achieve self-actualization. So humanism is still a very dominant theoretical model in that field. Okay, we are getting close to the end, but the last psychological model that I want to talk about is behaviorism. So as we've kind of moved through the history of psychological models, we've gotten more and more close to modern evidence-based psychology and treatment for mental illness. Behaviorism arose in the 1950s. It kind of emerged from post-World War II academia and thought in psychological science. Behaviorism was kind of the first psychological theory to be driven by scientific evidence. And by that, I mean, the theories of behaviorism are not just based on observation, but they're actually supported by experimental evidence. And the basic tenet of behaviorism is that humans, like all other animals, learn about their world and how to act in it through observing associations between events. So it makes a distinction between unconditioned stimuli, which are any external events in the world that have some kind of inherent meaning to us. So things like pain, food, sex, all of these things mean something to us. We don't have to learn that food is good, that pain is bad, or that sex is good. We're kind of born intrinsically knowing that. By contrast, conditioned stimuli are things that acquire meaning through the environment, through context. So through repeated pairings with unconditioned stimuli. So little kids don't know that fire is dangerous, but they might learn it through repeated pairings with pain, where every time they touch something hot or every time they get too close to the fire, they feel pain. So pain is an unconditioned stimulus. We're born knowing it's bad. Fire is a conditioned stimulus. We have to learn that it's bad because it's paired with pain. So other examples of conditioned stimuli are symbols. So these symbols here don't have any inherent meaning, but because of what they're associated with in our lives, we sort of instinctively know what they mean. They kind of mean food, pain, and sex, but they acquired those meanings through pairings with those concepts. They didn't have those meanings before. So behaviorism, unlike most of the models we've talked about so far, actually explains most things about psychopathology. It really does give us a framework for understanding problems with thoughts, emotions, and behavior. So just as an example, this is a picture of little Hans. He was a patient of Freud's, and Freud treated him for a phobia of horses. He was afraid of horses ever since he was about 4 years old, and he saw one basically have a heart attack, collapse, and die in the street in front of him. And he was with his nanny at the time. She got really upset seeing this horse die. Hans got really upset, and ever since then, he was terrified of horses, which was a really big problem in Victorian England because that would be like panicking at the sight of a car today. Horses were everywhere. So Freud's interpretation of where this phobia came from, and therefore how to treat it, was that Hans had a problem with his psychosexual development. So he was like 4 years old, 3 or 4 when this happened. So Freud believed that he was in the phallic stage of development when he developed this fear. And so Freud believed that Hans had a normal, typical fear of his father's penis. Because of the Oedipal complex, Freud believed that little boys were in this sort of to the death competition with their fathers, that they secretly really wanted to kill their fathers, but knew that they weren't big and strong enough to do it. So they had this unconscious fear and hatred for their fathers. And Freud believed that Hans, as a defense mechanism, because he didn't want to be afraid of his father and didn't want to have to kill him, displaced that fear of his dad onto horses. And that's why he was afraid of horses. So Freud's treatment for this would be to help little Hans progress through the stages of development, help him recognize that he actually did want to kill his father and marry his mother, but then get past that and realize that he would grow up one day to have a penis himself and be able to be like his father, but not actually be his father. That was Freud's model of psychopathology. That doesn't mean that Freud believed that anyone who had a problem with the phallic stage of development would therefore develop a phobia, because again, there was no specific relationship between the type of symptom someone had and the stage that they were fixated in, which is one reason why this isn't a great explanatory theory for mental illness. There's no one-to-one relationship between cause, in this case, the phallic fixation, and symptoms. The behavioral take on this, though, is that for most people, horses are a neutral stimulus. We don't have any inherent feelings about them. But Hans had a really scary experience with a horse. He saw a horse die, and that created a lot of fear, anxiety. The adults around him reacted with fear and anxiety. So that association, a horse, which was neutral, and being upset, seeing adults being scared and upset, created what's known as a conditioned response, where before horses were neutral and didn't cause any response, a horse was paired with a negative unconditioned stimulus, being scared. And after that, horses created a conditioned response, being scared. So even though he never saw a horse die again, every time he saw a horse, that triggered a memory of the horse dying and the same physiological emotional reaction that he had when that horse died. So horses went from being a neutral stimulus to one that caused a lot of fear. And that is the behavioral model for how phobias develop. So if you think about those two theories, one of them kind of suggests like a logical next step for treatment, which we can talk about in class in person. So just as a quick reminder, and we will definitely cover this a lot in class, but behaviorism basically explains behavior and emotions through two kinds of conditioning. The first is classical conditioning, which we just talked about. This is where we learn to associate two events via repeated pairings. And we learn to have conditioned responses. So we learn how to feel about and react to things that used to be neutral based on the unconditioned stimuli that they're paired with. So every time we see a needle, we get a little bit hurt. Every time we open the Tinder app on our phone, we have the opportunity for sex. That's how those things acquire their meaning, through classical conditioning. Operant conditioning has to do with learning how to act. So operant conditioning involves learning that a behavior that we do produces a specific result, either a reward or a punishment, and that increases or decreases the frequency of that behavior. So for example, if you have a dog that likes to beg at the dinner table, and every time it begs, you give in and give it some of your food, you're teaching that dog to beg by rewarding the behavior of begging. Food is an unconditioned stimulus. It's positive. So giving the food in response to the behavior means that that behavior is going to increase. This is just an example of, whoops. All right, we're not going to show that. We'll show it in class. Okay, so summarizing things, wrapping it up. Even though behaviorism explains a lot, especially about anxiety disorders and things like phobias and panic disorder, but also trauma-related disorders, obsessive compulsive disorder, it still doesn't explain absolutely everything about abnormal thought, emotion, and behavior. And in fact, no single unidimensional model, no one explanatory model can really explain the complexity of human behavior and human psychology. So our modern understanding of psychology is that psychopathology is a complex phenomenon that is influenced and that involves the interplay of our biology, so our physical bodies, our brain structures, the neurochemicals that we produce, psychology, so our learned behaviors, our emotions, our the ways that we think about and interpret the world, our belief systems, and the environment. So our cultural context, which again helps to determine what is even considered normal and abnormal, but also our parenting, our upbringing, the way that we were treated by our caregivers when we were young, and the life experiences that we have. All of these things interact with each other and influence each other. to produce specific symptoms of psychopathology. And modern psychology believes that every problem with thought, behavior, and emotion does have a specific cause that can be attributed to biology, psychology, and the environment. Usually not just one of those things, but a complex interrelationship of all of those things. But there is, in modern psychology, we believe and study to try to identify the specific knowable cause of thoughts, emotions, and behaviors. So to kind of round things up, we covered the spiritual, biological, and psychological models that have helped govern historical thought about psychopathology, and talked about how no single model actually can explain everything about psychopathology. In our more recent history, the field of psychological science has had more of a psychological understanding of things. So rather than trying to locate problems with thought, emotion, and behavior in specific brain structures and regions, for our recent history, psychologists have really focused on the mind and psychology. So this started with mental hygiene and moral therapy, which was basically just the observation that people with severe mental illness are still people. They have needs, their functioning is better when their life circumstances are better. And that means that we might be able to learn something about mental illness from observing typical people and trying to understand how the healthy brain works in order to understand how the unhealthy brain works. Psychoanalysis kind of built on that by saying that problems with behavior, thoughts, and emotions are caused by abnormalities in development. And Freud had a very specific developmental theory that isn't really evidence-based, but that insight that development during childhood influences adult functioning is true. Humanism is a school of psychology that really recognizes that everyone has certain basic needs, and that when those needs are not met, our functioning can never be perfect. Our functioning can never be ideal. And that in addition to needing maybe counseling and mental health care to achieve better functioning, people also need good physical conditions. They need money, they need security, they need food, they need a job, they need respect and dignity. And of course, modern psychology still believes that too. And then lastly, behaviorism, it was the first scientific field of psychology, the first field to develop theories using experiments and falsifiable data. And behaviorism explains thoughts, emotions, and behavior as being shaped by contingencies in the environment. So everything we do is a learned behavior, or it's an instinct. And all of our learned behaviors are learned through pairings with instinctive behaviors or with stimuli that cause instinctive responses. In the next lecture, we'll talk a little bit about how a modern understanding of psychology integrates biology, cognition, so thoughts, psychology, the mind, and culture and the environment. And these are some study questions to help you kind of work through this lecture and take notes.